thank you again for hosting this.
And Senator Kelly.
Thank you, Mr. Chairman. And thank you all for being here today to discuss this critical issue that faces too many Americans that carry not only physical but also medical effects for families, but also the high cost for folks that live with diabetes. And President Nygren, great to see you here. Good to see you again. And thanks for being such an important voice on this issue. I spent a good amount of time on the Navajo Nation, and I know well the impact that diabetes has on our tribal communities. We've got 22 tribes in the state, and this disease has dire consequences. And there are a lot of individuals that are suffering from this, and many are members of your tribe and the other tribes. And I know you've worked very hard to impress upon the federal government the importance of the special diabetes program for Indians. Could you talk a little bit more in depth about that, the impact it has had on the Navajo Nation, and tell us why it's so important that Congress reauthorize this program before it expires at the end of September, and what are the consequences if we do not reauthorize it?
Thank you, Senator Kelly. I appreciate you. I'm always happy when you spend some time out in our communities and all the communities across the state of Arizona. But one of the effects that I've had is just to read some statistics here is for the first time, diabetes prevalence in American Indian and Alaskan Native adults has decreased and has done so consistently for 4 years, dropping 15.4% from 2013 to 2017. So I think that just the decrease in diabetes prevalence was great through the SDPI program. Also, diabetes-related mortality has decreased from about 37% during those times. Again, these are just some of the stats. The key thing there is it's decreasing. Whatever the percentage is that this program is working, and we're really trying to, it's very unique. There's over 300 communities that it's serving across the country. I know there's, I think, about a dozen that's tailored to the Navajo Nation. But overall, I think it's critical because we're trying to make sure that we can continue to have healthy people in our communities so that they can thrive, and for it to be renewed, which is coming up very soon. And I think that both the Senate and the House has approved it for about $170 million through their committees, and really that's $20 million more than the $150 that we were initially getting. And that $150 has been consistent for 20 years, so this $20 million is a good amount of increase to really help us get some of those programs out there implemented right away, because it's critical in terms of not every Indian country is the same, but the tailored approach and the partnership that we've been able to develop through this program has really helped us, because I always see pictures of our elders. They were young, they were slim, they're fast, they looked very healthy a lot of the time. So when you look through histories of, because as the president, I have access to historical photos and things like that I look at that's within our communities. They were farmers, they were ranchers, there were gardeners, and you just look at how healthy some of these people look through history, and then you look at the people now. It's very sad to see that we've come from very self-determined, self-resilient people to people that are just really trying to fight for their lives on a daily basis. So again, I think that this program is critical, and I definitely would continue to urge both the House and the Senate to approve this. So thank you, Senator.
What would happen if we didn't reauthorize it?
For the Navajo, all of Indian country would lose they'd lose staff, they'd lose the programs, they'd lose the people.
But tell me what the consequences of that would be. I mean, I think we know what the consequences are.
Yeah, I think you'd lose a lot more people to diabetes.
Yeah, people would die.
Mm-hmm.
And probably in significant numbers.
Significant numbers, and you would also, a lot of people would lose hope and faith, and it would just be very, I think it would just break a lot of hearts, because not only are you looking at communities that are already in dire poverty levels, but you would put them in even tougher situations.
And folks, even, some can't even, for seniors, insulin's now capped at $35 a month, and, for some other individuals, the pharmaceutical companies have provided insulin at $35 a month, but that could still be very hard to afford for members of the Navajo Nation, which is one of the poorest areas of the country. And that is true for the other tribal communities in the state of Arizona and across the nation. So it's critical that we reauthorize this program in September. Thank you.